Hey everyone, let's talk about something that can trick even eagle eyes in dentistry. Cervical burnout. This isn't some fancy new disease, but it can show up on dental x-rays, especially bite wings, and look a whole lot like a cavity. In this video, we're going to bust open the mystery of cervical burnout, covering what causes it, how to spot it, and why knowing about it matters. Dental x-rays utilize ionizing radiation to visualize the internal structures of the teeth and jawbone. These x-rays are differentially absorbed by various dental tissues. Enamel, the hardest and most radiopaque tissue, absorbs a significant portion of the x-ray beam. Dentin, the underlying layer, is less radiopaque, allowing some x-rays to pass through. Finally, the root cementum is the least radiopaque structure. The cervical region, where the tooth crown meets the root, presents a unique anatomical feature. In this area, the tooth structure thins considerably compared to the crown or root. This thinning results in a decreased amount of dentin present to absorb x-rays. Due to the reduced dentin thickness at the cervical, a greater number of x-rays pass through this area compared to the surrounding tooth structure. This increased X-ray penetration translates to a darker or radiolucent area on the resulting X-ray image. This radiolucency is the hallmark finding of cervical burnout and can be mistaken for a carious lesion. While cervical burnout can mimic a cavity on X-rays, several key features help distinguish them. Location. Caries typically initiates on the tooth surface above the gum line, progressing inwards. Conversely, cervical burnout appears strictly at the cervical region, adjacent to the alveolar bone. Borders. Caries often presents with irregular, ill-defined borders. In contrast, cervical burnout exhibits smooth, well-defined, and rounded borders. Clinical examination. A thorough dental examination by a dentist, including probing the tooth surface for softness and examining for visual signs of decay, aids in differentiating between the two. Cervical burnout itself is not a pathological finding and does not necessitate any treatment. However, its presence on X-rays warrants further evaluation by the dentist to rule out the possibility of actual dental caries. Additionally, cervical burnout can sometimes mask underlying pathology, such as root resorption or furcation involvement. Cervical burnout can also be seen in multi-rooted teeth when roots that are more buccally positioned do not overlap perfectly with a lingual or palatal root in a mesiodistal direction. The presence of a shallow furcation on either the mesial or distal surface of the tooth can make the area appear more radiolucent. However, the presence of two overlapping roots can be confirmed by identifying the periodontal ligament spaces of each root. This image is showing cervical burnout, which can mimic a carious lesion. This bite wing is showing carious lesions, which, compared with burnout, demonstrate an irregular border and a discontinuity of the tooth surface. They are often present in patients with periodontal bone loss. The difficulty with a root caries lesion is to differentiate it from cervical burnout. Some radiographic signs can prove helpful to the practitioner. First, when there is no bone loss around a tooth, it is very likely that the radiolucency at the edge of the root is simply cervical burnout. Furthermore, with caries, clinical examination would demonstrate an irregularity or a depression. With cervical burnout, the root surface would be intact. Fortunately, most root lesions can and should be detected clinically, whether they are buccal, lingual, or interproximal. Cervical burnout is a radiographic artifact encountered in dental X-rays. By understanding the principles of X-ray absorption and the unique anatomy of the cervical region, dentists can effectively differentiate cervical burnout from dental caries. A comprehensive dental examination plays a crucial role in confirming the diagnosis and ensuring proper patient management. Thank you for watching. If you liked this video, please like and subscribe. Goodbye.